Yeah.
Okay. Alright, Paul, so today we're going through your adult pre-exercise screening tool. The purpose of doing this is to try and get as much medical information about you as possible. And the reason we do that is we need to try and identify what's called contraindications to exercise. A contraindication is anything that is present that could be potentially harmful to you while you are exercising. It can be something as simple as a sore knee to something more serious as cardiovascular disease. I'll be asking you questions in stage 1 and then we will flip over and move on to stage 2. In identifying these contraindications, it helps me determine an appropriate level of exercise for you to work at and helps me determine what exercises to put in your program. One of the important things I can get by doing this pre-exercise screening is it tells me whether I need to refer you to a doctor to get a medical clearance. Are you happy for me to go ahead with this?
Yes.
Excellent. So we'll just pop your name at the top here. And your date of birth was the
25th of the 4th, 1983.
excellent, and your male. Fantastic. So the aim of this is to identify individuals with a known disease, sign or symptoms of disease who may be at higher risk of an adverse event during physical activity or exercise. It is usually self-administered and self-evaluated, but because I'm here with you today, we can go through it together. So has your doctor ever told you you have a heart condition or ever suffered a stroke?
Nope.
Do you ever experience unexplained pains in your chest at rest or during physical activity?
Nope.
Do you ever feel faint or have dizzy spells during physical activity or exercise that causes you to lose balance?
Nope.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
Nope.
Do you have diabetes?
Nope.
Great. Do you have any diagnosed muscle, bone or joint problems that you've been told could be made worse by participating in physical activity or exercise?
No.
Do you have any other medical condition or conditions that make it dangerous for you to participate in physical activity or exercise?
No.
Perfect. Now, because you have answered no to all of these questions, we can move on to stage 2. So I'll just get you to sign at the bottom there. Great. Fantastic. So the aim of stage 2 is to identify those individuals with risk factors or other conditions to assist with appropriate exercise prescription. This stage is to be administered by a qualified exercise professional, which is me today. So how old are you, Paul?
32.
Great. So because you're under 45 years old and male, there's no risk factor for that one. Any history of heart disease?
No.
Fantastic. Do you smoke?
No. Never.
Great. And just describe your current physical activity exercise levels. Would you say it's sedentary, light, moderate or vigorous?
Probably moderate to vigorous, I'd say.
Great. And how often during
5 or 6 times a week, I'd say, usually.
Great. And how long usually?
Around 60 minutes.
Great. So that is about 300 minutes a week. Because it's greater than 150, you get a -1 risk factor. And we worked out earlier your height was 1.73 meter and your weight is 84 kilos. So your BMI we worked out was 28. Because you are under 30 with your BMI, there's no risk factor there either. Have you been told that you have high blood pressure?
No.
Correct. Have you been told that you have high cholesterol?
Nope.
And have you ever been told you have high blood sugar?
Nope.
Great, so far we are -1. Have you spent time in hospital, including day admission for medical conditions, illnesses, injury in the last 12 months?
No, I haven't.
Are you currently taking a prescribed medication for any medical conditions?
No.
Guessing you're not pregnant. And do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
Fantastic. Okay, so what we need to do now is just assess your risk stratification. So we add up everything here and you become a -1. So you are a low risk client. So individuals at low risk may participate in aerobic physical activity or exercise up to a vigorous or high intensity. So now we refer to our exercise intensity table, which is this. So with your vigorous to high, you can do, your heart rate max can be up to 90% and greater. And in terms of your RPE, which is your rating of perceived exertion, you can be greater than 7. So great thing we found out today is that you don't need a medical clearance, and we can get you a program and you can start exercising today.
Cool.
Excellent, thank you.